Okay.
Good morning to all. My name is Kamisha Williams, and I would like to first start by saying I'm delighted to be a part of Hobart's Dental Association. I, along with two others, have been hired to establish an office system that will help the clinic check in and out patients, file claims, and most of all, accept different types of insurance. I would first like to say Medicaid was the first issue that came about when we first had to make this decision. I honestly feel that the company itself should accept Medicaid because it will be helping a lot of families who's in need at a time like this. I also have a presentation behind me, different information behind me that hopefully will help you consider accepting Medicaid.
Go on the other side.
What is Medicaid? Medicaid is a federal and state assistance program that pays for health care for families with low income and few resources. Just think, we will be able to help out people who have low income and who will be able to we will also be able to help out kids that is born into families with low income. Individuals that we would be helping if we accept Medicaid. We will be helping people who receive foster care or adoption assistance. We will be helping pregnant women whose family income is below 133% of the poverty level. Also, infants born to Medicaid eligible pregnant women and people who are eligible for temporary assistance for needed families. What does Medicaid help with? Medicaid helps with medical bills such as doctor fees, prescription drugs, and hospital charges. The following may be eligible depending on the amount of monthly income and resources available to the individual and family, and the amount of medical expenses. Normally, Medicaid will help with kids under the age of 21, and also it will help with the families whose income is really low. Just think, many families have kids that need dental assistance but can't get it if they do not have Medicaid and if the doctor office does not accept Medicaid. Advantages that accepting Medicaid will bring to the clinic. It will bring more patients. According to the economy records, more families are receiving Medicaid than ever before due to the lack of jobs and higher layoff rates. It will also bring guaranteed payments. Whenever a patient has Medicaid, Medicaid will cover majority of their expenses. States may require the patient to make small payments in the form of deductibles, co-insurance, or co-payments. Also, it will bring the fee-for-service. Medicaid clients enrolled in the fee-for-service plan may be treated by the provider, and after submitting the claim to Medicaid, Medicaid pays the provider in full. Just think about it. Most people go to the doctor and they have different bills that they do not cover at the time because they may have issues with income or anything of that sort. But just think about it. If we were to accept Medicaid, Medicaid will pay that provider in full. For adults, Medicaid will pay up to $500 a year for most dental care from July 1st to June 30th, or each year. This includes one office visit, one cleaning, one set of x-rays, and one fluoride treatment. For children under age 21, dental care is covered for children with Medicaid. This includes orthodontic care, such as braces, if needed for medical reasons. Also, all orthodontic care must be approved by Medicaid before treatment. As you all know, with anything that you have in life, you're going to have the pros and cons. Well, I have a list here of the pros to accepting Medicaid. And the pros are larger patient base, more income for the business, and it helps the less fortunate with a very necessary medical service they may not otherwise receive. The cons, on the other hand, billing issues, being unable to bill the member for the full cost of services, slower payments from the patient, slow reimbursement from the government, limitations on types of services to be provided to the patient, and additional paperwork requirements and guidelines. Now I would like to ask, do anyone have any questions about the presentation or the information that I have provided you with? Thank you so much. After going on with the presentation, I would like to say that it's time to conclude if there's no questions. Hopefully, after reviewing the information that I have given,
6 minutes.
hopefully you all will be able to see why it's important that our clinic should accept Medicaid. And most of all, the children that needs dental care may not be able to receive that dental care without the company to accept their Medicaid. Medicaid is a very, very important part of dental care and also other types of care. And some people are unable to provide or to receive service without Medicaid. More than 50% of families now are on Medicaid due to the hardships that they're going through. So hopefully after reviewing this presentation, hopefully you will see why it's important that Hobart's Dental Association should accept Medicaid. Thank you.